Welcome to Mindray, Patient Monitor Application Guidance. This module is the guidance of ST monitoring setup, covering enabling ST analysis, ST alarm setting, ST graphic display, and notes on ST monitoring. The ST analysis is disabled by default. Before you start ST monitoring, press the ECG area to enter the ECG menu. Access to ST, Setup, and switch on ST Analysis. Once the ST function is enabled, the ECG filter will be changed to ST mode automatically. To display ST segments and numerics, press the Screen Setup Quick key. Or access to the main menu. In the display column, select Tile Layout. Click the Waveform area, and then select ECG, ST segment. The ECG numerics will be shown in the parameter area. The Waveform area displays the current and baseline ST segments as well as values. The current ST segment and value are green, while the baseline ST segment and value are white. The monitor automatically selects the 3 most deviated leads for the ST segment display. You can also manually choose the leads to display in the ST setup menu. To set ST alarm functions, enter the ST alarm menu. If the ST alarm is disabled, there will be an alarm off symbol shown in the ST numeric area. There are 2 ST alarm modes, absolute and relative. In the absolute mode, the alarm is triggered by the absolute ST value that is over the limit. However, in the relative mode, the alarm is based on the relative change of the ST value rather than the absolute value. ST single alarm means that when the ST change of any single lead is over the limit, an alarm will be triggered. ST dual alarm means that the ST changes of 2 or more leads are over the threshold. ST deviation is typically monitored as a relative change from a baseline value. Before ST monitoring, a baseline should be set when ST values are stable. If you don't set the ST baseline, the monitor automatically saves the baseline when valid ST values appear for 5 minutes. Press the ST segment area, and you can access to a more detailed ST view of all ECG leads. You can set a new baseline here, or hide the baselines in the ST view. Displaying markers is to show the isoelectric point, J point, and ST point, which are used for ST measurements. The ST value is the potential difference between the isoelectric point and the ST point. The isoelectric point provides the baseline. The J point is the end of the QRS complex. The ST point is at a distance away from the J point. These measurement points can be adjusted in the ECG ST menu. The Auto Adjust function is enabled by default. Positions of isoelectric point and J point are automatically adjusted accordingly. The ST point is typically J points plus 60 milliseconds, but it can be adjusted regarding the patient's heart rate or ECG morphology changes. Except for ST segment and numeric display, Mindray offers an exclusive clinical assistive application, ST graphic, to provide a more intuitive notification of ST deviations. It is a graphic representation of the ST changes in an easy-to-read histogram. The display varies in 2 ST alarm modes. When the ST alarm is set to absolute mode, The height of the bars indicates the absolute ST value. The color of the bar indicates the ST alarm status. Green indicates that the ST value is within the normal range. Cyan, yellow, or red suggests that the ST value exceeds the alarm limit, which matches the alarm priority setting. In the relative ST alarm mode, there are 2 bars for each lead. The height of the gray bar indicates the baseline ST value, and the colored one on it indicates the change of ST value. Green means that the ST change is within the normal range. Yellow, cyan, or red means that the change is over the alarm limit. The over-threshold color depends on the alarm priority setting. Most importantly, ST graphic divides the limb and chest leads into 3 groups, representing 3 anatomic locations of the heart: anterior, inferior, and lateral walls. It is very intuitive to indicate which wall of the heart is suffering from ischemia or infarction. Also, in the screen setup, you can display the histogram of the ST graphic in the waveform area directly. In the end, please be noted, some situations may affect the reliability of ST monitoring. Firstly, you are unable to get a lead which is noise-free. Secondly, arrhythmias, such as atrial fib or flutter, cause irregular baseline. Thirdly, the patient is continuously ventricular placed. Fourthly, the patient has left bundle branch block. In the above cases, you may consider switching off ST monitoring. This is the end of ST monitoring setting guide for Mindray patient monitors. Thanks for watching.